What if two of the world's most dangerous viruses joined forces? What if COVID-19 and Ebola combined into a single supervirus? Today, we're diving into a terrifying hypothetical scenario. Imagine a virus with the high transmission rate of COVID-19 spreading effortlessly from person to person. Now add the deadly hemorrhagic fever of Ebola, causing internal and external bleeding, organ failure, and a horrific death. It's a nightmare scenario that could potentially decimate populations. COVID-19 has shown us how quickly a virus can spread worldwide. Its ability to transmit through respiratory droplets and even linger on surfaces makes it incredibly contagious. On the other hand, Ebola, though less contagious, is far deadlier, with a mortality rate reaching up to 90%. So what if these two viruses combine their worst traits? The result would be a pathogen that's not only highly contagious but also extremely deadly. Such a virus would have the potential to spread like wildfire, leaving devastation in its wake. Healthcare systems would be overwhelmed in days, hospitals would run out of beds, ventilators, and essential medical supplies. Doctors and nurses, already stretched thin, would face an impossible task. The death toll would rise rapidly, and the strain on society would be immense. Vaccines and treatments? Currently, we have effective vaccines for COVID-19 and experimental treatments for Ebola. But a new supervirus would render existing vaccines useless, and developing a new one would take time, precious time we might not have. Quarantines and lockdowns would become a grim necessity. International borders would close and travel would grind to a halt. Economies would collapse and daily life would be upended. The psychological impact would be profound. Fear and uncertainty would grip the world, leading to widespread panic and social unrest. Communities would struggle to maintain order and trust in public institutions would erode. Is this scenario likely? Thankfully, nature rarely combines viruses in such a catastrophic way, but it's a chilling reminder of the importance of vigilance in public health. Ongoing research, global cooperation, and investment in healthcare infrastructure are crucial to preventing and responding to potential pandemics. So, while this doomsday virus might just be the stuff of nightmares, it underscores a vital lesson. We must remain prepared. Because in the battle against infectious diseases, complacency is our greatest enemy. Thanks for watching. If you enjoyed this video, like and subscribe to stay updated on more fascinating what-if scenarios. Stay safe and stay curious.